Hi, this is Dr. Kathryn Dao. I'm the senior editor for the Rheum Now Women in Rheumatology campaign. Welcome to Rheum Thoughts. And what I want to share with you is my life in the gray zone. For someone who grew up in a family of engineers where logic, definitive answers, these were absolute. I actually live comfortably in the gray zone of uncertainty. Rheumatology has been a field where the art of medicine is still practiced. Symptoms, physical findings may overlap other disciplines. Testing can yield more confusion than answers, and many treatment guidelines, they're actually based on expert opinion rather than data. What biologic to use next? That's anybody's best guess. Steroid tapers? Shoot, they're free for all. And clinical gestalt reigns mighty. The past 2 weeks of being on hospital consults at our county hospital have really stretched me to my limits. And I pride myself on keeping current on the data. I feel like I'm a pretty good rheumatologist, but the cases I've encountered have truly humbled me. It wasn't unusual to be consulted on a rare case or a rare presentation of a disease. And these consults required me to reach into the depths of my internal medicine knowledge. I've actually had to search the published literature, reread textbooks. I called my colleagues from other institutions and consulted with my former professors, asking for help to make the diagnosis and to formulate the best treatment plan for the patients. Rheumatologists, we're excellent at pattern recognition, but when the pattern does not make sense, it leaves us feeling uneasy. Many will revisit these difficult cases to see if there's clues missed. Sometimes ruling out a disease will help hone the diagnosis. One of my mentors, Dr. Richard Brasington, had taught me it's just as important to tell the patient what they don't have when you don't know what they do have. Often, patients are relieved to hear they do not have cancer, multiple sclerosis, or lupus, even though their diagnosis is still unclear. So how do I live in this gray zone and not get frustrated? Well, I follow these 4 rules. The first one is regular follow-up. Unlike an episode of House where each medical mystery is solved in 45 minutes plus commercials, difficult cases can take time to marinate so that they can fully declare themselves. So regular follow-up is important because you'll be able to figure out what the case is. Second, considered empiric trials of therapeutics. And this could actually be helpful to draw out the diagnosis. As you all know, some patients with classic polymyalgia rheumatica symptoms don't have elevated inflammatory markers, but they do respond beautifully with low-dose glucocorticoids. So sometimes you just gotta treat what you see. My third rule is phone a friend. When you get too close to a case, you might miss what's in front of you. No one's expected to know everything. The rheumatology community is known for its camaraderie. We help each other. I've emailed experts, key opinion leaders in the field to ask for help, and they were more than happy to listen and offer advice. The cliches, no man is an island and it takes a village, this actually applies to rheumatologists. And my fourth rule, sometimes you just have to let the patient go. And what I mean is let them go get a second opinion. I have told some patients their issues are beyond my expertise, and getting a second set of eyes may be helpful. Because I worry whether or not my own bias and limited knowledge could have blinded me to the diagnosis. Living in the gray zone can be unsettling for people who want clear-cut answers, but for me, it's actually a way of life. If answers were always in black and white, I think rheumatologists wouldn't be in such demand. Thank you for watching and listening. This is Dr. Kathryn Dao. Follow me on Twitter at KDao2011.